Thank you for tuning in to our regional conversations. The purpose of these is to make sure advocates across the state are hearing from different people in different sectors, different geographic regions, that we know homelessness exists throughout the entire state and it's not just a metro issue. During this interview, we have a special guest, Dr. Harsha Bangura, who is a family physician and rural health equity fellow in the Todd County region. So thank you for joining us, Alex.
Thank you for having me. Thank you.
Yeah, so our first question is, a lot of time people may not realize that physicians, doctors, they have passion in homelessness, housing, but for you specifically, why did you choose to allow us to interview you?
Well, I feel very strongly that housing is a foundational element of people's health. It's impossible to live a healthy life if you don't have a secure place to sleep, something that's heated, a place to store your medicines, and just the amount of stress and worry that goes along with having no stable housing can really significantly impact people's health. So it's critical. It's a challenge as doctors. It's not something that we can easily fix for people, unlike, prescribing medications. But we have to use our voice and our power in society to kind of help address these problems.
Right on, and thank you for using your voice in this platform.
Thank you.
Yeah, so how does, you're in Todd County, how does that play out in Todd County if folks come to the hospital? Are you aware that they're homeless, or where do they leave after the hospital?
Yeah, it's a huge challenge, and I think I have kind of a unique perspective because my training in family medicine was in the Bay Area, in a county hospital where we served a huge homeless population, an unstably housed population. And so I kind of grew up in medicine in an environment where homelessness was very front and center in terms of the social services work that we did in the hospital. And coming to Todd County, it's not that I didn't think homelessness was going to be an issue. It was more that I was sort of surprised at how literally absent the resources and systems are to help people when they find themselves unstably housed or unhoused. So in my experience, and I've only been in practice in Todd County for a year and a half, most of it during the COVID pandemic. But the few times that I have encountered it, it's generally been in the emergency room setting, generally in the context of somebody's mental health crisis, where they're brought into the emergency room by local law enforcement. And that's a situation where homelessness is kind of obvious in some sense, because it's part of the issue that they're coming in with. They're not there for another medical emergency typically. But there isn't anything really that you can do at that point besides have the law enforcement officers take the individual back to where they were brought in from, which might be a gas station. So I've had, conversations with social services, social workers that support our emergency room. And basically the conversation always ends like, yeah, give me a few days or a week and I can maybe find this person some housing. But there's no emergency bed. There's no transitional place that they can go right from the emergency room. And that's a huge deal, especially in the winter. You have somebody who's basically just being literally left out in the cold. So that's hard. And then I think the second issue is that it's not well screened for. We don't, homelessness is such a front and center hot button topic in urban environments because it's visible. But in rural areas, poverty is kind of everywhere in rural areas. But the people who are unstably housed or homeless are often very fringe in the rural community, you know, they're not on the street corner, they're living in the woods somewhere in a ice house, or, you know, so it's, or a car. And so it's just not quite as forefront in our minds as clinicians. And so we don't always ask the questions to find out.
Right. So you're saying there's not a lot of resources, there's really not a lot of places for people to go. So what would be the impact, and you can answer this either way, but what would be the impact either positively if we get more resources for homelessness, or what would be the impacts in a negative way if we do not get more resources for places like Todd County?
Yeah, I think it would be obviously hugely beneficial to the community in general to have transitional housing, emergency shelter beds available in people's communities. Because, and we see this with mental health crisis beds and things as well. People, you know, if somebody in this region becomes homeless, if they get connected services and they go somewhere, it's going to be Fargo, you know, 3 hours away, or the Twin Cities, or, you know, totally away from any sort of support network that they might ever have had. And also kind of pushing it outside of the community's level of awareness that this is actually a thing. So I think being able to have a place where people can stay in the community not only helps the people who need the shelter beds, but it also helps the community become a more resilient and welcoming and supportive community. So I would love to see it. I've actually been thinking about opening one, but I'm yeah, for the future.
Right. Or somebody in the Todd County region.
Somebody can do
it. Right. This has been pretty great. I mean, hopefully a lot of doctors, you know, you speak like somebody that's been in the housing advocacy world for years, maybe you have, but it's been really insightful. So I think to end this interview, is there any like message that you want to make sure for those watching this that sticks in their mind or that they carry with them?
Yeah, just don't forget about rural. You know, I think not, you know, obviously a smaller population of the state lives in rural areas, but it's a huge geographic area, and the needs are different in a lot of ways. But you know, I think I read somewhere on around the order of 30% of people who are homeless in rural Minnesota don't have access to shelter kind of beds compared to 20% who live in urban areas. So there is a disparity, and it is something that actually the numbers are such that you could actually make a huge impact if you put the resources in the right places. So it's not such an overwhelming problem. And yeah.
Yeah, right on. So hopefully, you know, our tagline is shelter saves lives, housing and homelessness. So, you know, if we do our job as advocates, hopefully we win at the Capitol, we get some resources that maybe we'll have resources for Todd County to develop a shelter transition.
We'd love it. Yeah.
Yeah. So
not just Todd County, but yeah, we'd love it.
Yeah. So thank you for letting us interview you, Alex.
Thank you.
Yeah, thank you to everybody that's watching and listening. Hopefully something that Dr. Alex said speaks to you and you can use some of this in your own advocacy. So thanks.
Thanks for the time.
Yep.
Bye.